Assalamu alaikum. Dear colleagues, on behalf of MG Maroc and our GP work networks, it's my honor to introduce our keynote speaker, coach and brother, Mr. Kamal FAIZ. With a deep understanding of the crucial role primary care plays in the health and well-being of communities, our keynote speaker has been working with us to empower general practitioners and improve patients' outcomes. A true visionary and leader in his field, medical English and leadership, please join me in welcoming Mr. FAIZ. The floor is yours.
Thank you. Thank you. Am I loud enough? Do I need this? Hello? It's better? Yes. This one is better. Okay. It feels weird working with the mic on the hand. Okay. Next time we should look for the hand-free mics. Mr. Tassi. Good morning, everyone. As I said earlier, it feels home. And what a surprise this morning. Somebody came to me, it's like, Mr. FAIZ, do you know me? Do you remember me? And she's breathing like, it's like, oh, do you dyspnea or something? What's going on? She's like, do you remember me? Do you know me? It's like, no, I'm sorry, it's the first time I see. It's like, Dr. Siham Hanana, I'm your student. Welcome, Dr. Siham. It's a pleasure. I've been working with Dr. Siham Hanana for, mashallah, for 3 years. 3 years now. 3 years now she's still. And she came with an enthusiasm like she's seeing somebody for the first time, but with a great energy. Welcome back. This is your home. I would like also to take the chance to welcome the new faces who are here today. Doctor? Amal? Mariam? Your last name? Kiyo. Where do you practice, Dr. Mariam? In Sali. Okay, and you? Amal Saeed, where do you practice? Oh, okay, excellent. With me, Dr. Yaqoubi. It's a pleasure to have you back on your feet after the critical condition, al-Islamtic. And it's a chance to turn over a new leaf, and it's good to see you as right as rain. What did you get from here? As right as rain, turn over a new leaf. It's English, right? But if you put them together, this sounds strange. As right as rain. So we have right and we have rain. So if the doctor say to the patient, good to see you back as right as rain, it means happy to see you, or on your feet again. On your feet again. So if I don't have this cultural competency, maybe I'm fluent in English, but somebody said to me, as right as rain, how are you doing there? Oh, it means that he is back on his feet, and he is healthy. Nice meeting you. At the back, you are Dr. 8 of, okay, I saw you. My dear friend, Dr. Shihab, the first day she came in to the Congress, like, I saw your name on the list. I'm gonna just make sure that I'm not gonna miss this chance to see you in action. Sorry, I missed my English, or I forgot my English. Like, no, it's not about forgetting, it's just about practicing, not practicing. So welcome, Dr. Shihab. Shihab also is the family doctor of my family in Casablanca, so it's good to have you, Dr. Shihab. And Dr. Ma'louli. Okay, and where do you practice, sir? Here in Tangier. So when you're playing in your camp, we are guests. You're our host. It's a pleasure to have you. It's a pleasure to have you here, and you are making it a little bit even. So we are 4 guys here, and we're outnumbered by some female doctors, mashallah. Dr. Ghizlan. You're practicing in Sali? Oh, okay. How long have you been practicing now? 5, 6 years more? Yeah, I guess so. Okay, so happy to see you back. Dr. Alami, of course, Saida, our veteran, and Dr. Tassi, they've been with us also for the online training. For how many years now? Since the eruption of Corona. Yeah, since the eruption of Corona. June the 9th? Sharp memory. Oh, okay. Barakallah, Mr. Tassi. Sharp memory. 2020. Oh, it's been a while. Alhamdulillah, it's been a while. It's been a while. And of course, Dr. Raja. Raja is the super enthusiast in the group. She's like, every time she calls me, thank you, in English. Merci beaucoup, خويا. الله يرحم الوالدين. So 3 languages in 1 sentence. Thank you so much. No, not yet. So we need to switch to Shlha. And she's really lovely. Every time there is a round table, scientific day, workshop, she's always looking around to improve herself with your click, with the group, or about thumbs up. Keep on believing in continuous in training for GPs. You are called the primary physicians. You are primary physicians. You provide primary care. The foundation, the ABCs of something. From you refer, you make decisions, so primary care. Primary care. In English also you are called GPs. GP, general practitioner. General practitioner. Next time if you want to practice introducing yourself, just briefly, because we've done this a lot with our former trainees, your name, your experience, how many years you have of experience, and the place of your practice. Hello, I'm Dr. X. I am a GP practicing for more than blah 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 years in this city, in Kaza, in Tangier. All right, and if you are in an international context, you can use your nationality. Moroccan GP practicing in Sali, Moroccan GP practicing in Skhirat or in Tangier. Okay, we're here today, so we don't want to waste a lot of your time. We're here today to see my roll up. Yeah, so to roll up our sleeves. Okay, how can I say this sentence if I am trying to run for an exam, to go for an exam my patient, or examine my patient? When can I use this word? Roll up my sleeves. In what exam? When do you ask your patient to roll up his or her sleeves? National exam. Blood pressure. Blood pressure. Blood. You know, blood pressure. Okay, blood pressure. So he said blood pressure. So the sentence needs what? Needs an action. A verb. So be careful when you talk to your patients. Use verbs so you can direct effectively the flow of your consultation in an easy way. Blood pressure. We'll come to that. Blood pressure. So let's roll up our sleeves and try to solve an issue we have all together here. We are all here together because we have one important challenge, which is, what is your challenge? Communication. What else? Why we're here? To study. Something specific about this workshop. What is it? Medical what? Medical care, yes. Through English language. Why English? I just French and Arabic, I can do my consultation. But why for me as a primary physician? Bravo, it's the first language, international language. Okay. How this international language is going to affect and influence me positively? In what way? Research. Bravo, you want to read articles, to communicate, to read an article. International congresses. Now it's easier than before. Now you can just one click away. You can participate with, in webinars across the globe, from India, from the US. You can join other international societies of diabetology, of endocrine, metabolic diseases, primary care. So you got plenty of opportunities. Let's switch the equation really quick. If you are attending an international congress and everything the professor is saying, you're not getting anything out of it, how would you feel? Frustrated. Frustrated. And if you feel frustrated time after time, everything the professor says, or everything the article says, you are not getting something out of it. The build-up of frustration leads to what? Abandon. You give up. You give up. And if you give up, what happens to you inside? Start doubting yourself. Disappointed. The moment you get disappointed, the devil said to you, welcome home. They're going to beat you to the ground. Yeah, you see? Where were you before, huh? What happened when you school? Why didn't you do that before, huh? You start getting you to the regret. And then leads to not believing in yourself again to get up back on your feet. And then it will be an irreversible cycle of learning. This session, quickly, I'm going to share with you some effective tips so you could see, wow, it's possible. So here today, the session is about possibilities. So what you had in mind about limitations, and this is something for young people, this is something I'm not interested in, my 23 patients a day, I'm fine. No, there are plenty of opportunities out there. So today we're going to quickly together see some opportunities that this is possible. Of course it's possible when you see Dr. Alami here, Dr. Tassi, and it's possible because look where we were and where we are today. Where we are today. What is that thing? Okay. What do you see here? Quickly. The wall is separating two people. So the wall is a symbol of what? It's a barrier. It's a boundary, like barrier. It's a barrier. Okay. One of you is the patient. One of this is a GP, is a doctor. What's going to happen? Miscommunication. So a lot of effort. A lot of effort means you're sweating, palpitations, eyes, pupil, so stress. 3 situations like this every day. Burnout. You close the practice and you change the job. So our job today is just to make sure to destruct or to break this barrier. Because I need this patient, I need to communicate with or establish a bridge. That's why we call it a bridge of communication. Without the bridge, you cannot reach this point, and you cannot reach the other point. So communication is about building bridge. What is the condition of this patient? For instance, you see this patient. Headache, tired, good. Symptoms, headache, tired. Stress, what else? Burnout. Sadness. Hard work, effort. Okay, what else? Why? What's going on with this guy here? There's another condition. You haven't thought about it. Before we get to stress. Yes. Fatigue. It is fatigue. So how can I, as a primary physician, how can I make sure that this condition that I'm having, or the chief complaint, motif de concile? The complaint is about fatigue, not about depression or stress or anxiety. Right. How can I know that this is fatigue, not this? How? As a doctor. What do you need to do? Communication. So you need to talk, to ask. Wow, to ask. That is the point. That makes a difference between a successful GP consultation program with non-successful one. It's making questions. I cannot say to them, no, you need to hear his version. You need to communicate. So you need to hear his side of the story through asking questions. These questions we usually talk about, these questions are open-ended questions. How do you feel today? How are you feeling today? Let's go for a condition, any symptom you want. You are a patient. How are you feeling today? Come up with a complaint. Let's say, give me any complaints you want. Hello. How are you feeling today? Not well. Bravo. Thank you very much. Your name? Sarah. Okay. So I said to Sarah, how are you feeling today? She said, no, not well. Now, what English I need to have to break this wall and start the conversation? What do I need to say? Why? At the beginning. It's very, tell me about it. So remember, Dr. Amina, tell me. One verb is going to open wide the consultation to a story. We love stories. So we call it the patient time. The patient time. Tell me about it. Never go for why, the beginning of the consultation. Tell me about it. So it's going to open up to you and tell, well, I have this this terrible pain, this blah, 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 blah. So, how are you feeling today? Not well? Tell me about it. She tells you 1, 3 things that are not enough for you as a doctor. What do you say? What else? Well, anything else? Tell me more. I'm talking for people who are English as it's not. Tell me more. Tell me more. You get more information. And this next information probably is critical to the diagnosis. It's very important. So I don't need to finish the interview and then repeat all over from scratch. It's very important. So we have no idea whether this person has fatigue, symptoms, or anxiety, or depression, or it's just a cliche picture. So I need to ask. Never take the non-verbal communication for granted. Never take the non-verbal communication of a patient that it is a condition or an indicator for you to base your diagnosis on. Maybe just the waiting room made him tired, not the medical condition. Quickly, I'm not going to talk a lot about this, but there are some, well, that's okay, we can kill the light. It's okay. There are some influences of language barrier between the doctor and the patient. I will have your email, I will send you everything like this. No worries. I will send you this to your home. So the first one, we said earlier, frustration. Because the patient is telling me about other symptoms and I'm not getting it. I'm not getting it. The other thing is trust. The first thing I need to do to establish with my patient is trust. Trust. Trust issue. If you don't trust me, how are you going to trust the protocol? How are you going to trust the treatment? How are you going to respond to the I believe that building trust is the foundation, is the cornerstone to an effective or quality medical interview. It's difficult to get the consent. I'm going to touch him. If the patient is Moroccan, I can just tell him like this, like this, like that. But if I have a Norwegian or Chinese people, they don't like to be touched. So what do I need to do? I need to ask for the consent. Look, this is what I'm going to do. I'm going to touch you. I'm going to check your abdomen. I need you to take your shirt off. I need to do this. So it's really, really important for me to get the consent. How can I get the consent? Asking questions. The other thing which is more important for me than anything else is the threat to patient's safety. Miscommunication or poor communication, the patient can interpret this as a threat, menace. But he's safety. This doctor is just say, so this is probably not a reliable source of trust. I'm here not to establish connections. I'm here for a treatment. So probably this person is not safe. Probably whatever I'm getting here. So if I have this doubt about my safety, this is my primary concern, is to get safe out of this clinic or hospital or a medical exam. Let's read this part here. Could you read?
Thank you. Chest pain versus heartburn. A patient might describe discomfort in their chest, which could be interpreted as a chest pain related to a cardiac issue. However, the patient might actually be experiencing heartburn due to acid reflux, leading to a potential misdiagnosis if the language barrier prevents clear communication about the nature of the discomfort.
So what is the issue here? If we don't have a clear communication, probably we can confuse chest pain to confuse something to something else. Don't say with. Confuse something to something else, because they are close in terms of other symptoms. The patient, I'm a doctor, I don't speak really good English, and I say to the patient, the location of your pain. The patient tells me, this, it's confusing for me. Stomach, reflux, acid, is the heartburn, brûlure d'estomac, heartburn, or chest pain. I need to go for further questions. If it is chest pain, I need to check about whether this has to do with heart, with the heart. So if you don't ask further questions, maybe I will take it just a heartburn, brûlure d'estomac, and I will try the antacid and blah, and I will go to different pathology. I forget completely about the vital signs, the vital signs of stroke or cardiovascular diseases. The second one, can you read, please?
Sorry, my English is not very good. Shortness of breath with anxiety. Yeah, of breath. A patient may present with shortness of breath, a symptom that could indicate a variety of respiratory or cardiovascular conditions. However, if the patient is unable to effectively communicate their medical history or emotional state due to language barrier, the GP may misinterpret the symptom as solely physical and overlook the possibility of an anxiety-related cause.
Thank you so much. The most important word here is, what is overlook? What is overlook? Overlook. You don't pay attention to. Overlook means you don't pay attention to. You check, but you don't pay attention to something and you overlook it. Maybe I ask about, because I know how to ask about the gastrointestinal system, but I forgot to ask about the respiratory system. So I go for the other signs and I may have overlooked the respiratory signs or symptoms. Vocabulary, we have shortness of breath. What is the condition of shortness of breath? People cannot breathe. Asthma. Heart disease. Pulmonary disease. Panic attacks. Anemia. Dyspnea. Okay. This one I read it. That's what the picture I showed you. Confusion between fatigue and depression. I need to ask the right questions. Here. So our objective is to learn 3 things. If I master English, if I control this English, it's going to help me to facilitate something. What is it? Facilitate? Communication itself is good, but please talk about effective communication. My time is important, the time of the patient is important. I'm not here all day long to chat with people. So I need to go for what I want to do effectively. Of course, in medicine we don't talk about efficiency. We can talk about efficiency in other sectors, but for we expect effectiveness. And when English language fluency is going to help me facilitate this effective communication, next I'm going to enhance. Enhance means improve also my intercultural competences. That's what I want you to do. My intercultural competencies means I speak English, I'm fluent. My patient is from some northern regions of the United States, or from northern of London, or from South Africa. Do you think they have the same culture, these three spots in the world? Of course no. If I speak English and I'm thinking as a Moroccan, I'm not, I'm done. So I have to put myself in the position of others. And this is the second part of the training, which is the empathy language that I need to develop by the time. So put yourself into the shoes. How can I put myself into the shoes of others if I don't know how these people think? So there is a risk of misdiagnosing the patient if culturally I'm not dealing with. Because what is severe in Morocco is not severe in the United States. In Morocco, when you say, how are you doing? غنموت غنموت. هو دي زي عنده 10 l'échelle, the scale is always 10 غنموت. ولكن اللي قال لك أمريكا يموت. I'm fine. Does it hurt? No, it's fine. He's in pain. Especially when you talk about muscular or some joints or arthritis or something. He is in real pain. So the American says, I'm okay, but he is in pain. Eastern cultures, he's coming on his feet and he says, كنموت الطبيب. You know what? So we have to enhance the intercultural competence. From my opinion, and Dr. Tassi and Dr. Alamidi know that, from my opinion, it is highly important now for Moroccan primary care physicians to develop intercultural competency programs. And I will see probably in the future we can talk to the group of LIMJ if we could provide with some intercultural competency programs, and we can have some collaborators. And number 3, foster. What is foster? Foster is like to open wide something. Open wide. Okay, so now I'm fluent. I'm effective in my communication with my patients. I'm enhancing my intercultural competencies if I go to Dubai, if I go to London, if I go to India. Now it's a lot of professors they call me, really want to go for some surgical techniques in India, especially proctologists. And the others, South Korea, for radio frequency ablations, for thyroids. Poland, for technology in medical practice and surgeries in clinics. Donc, you see different parts of the world. So it's really, really important to take this into consideration. I have 1, 2, and 3. It's now a chance to enhance my opportunities as an international primary care provider. You are not making drugs, you are providing a service. Is it clear? Let's get to the language. I'm going to show you a quick technique so you could see, is this really an uphill mountains to control this language that I can use on day-to-day practice as a general practitioner. First word. Ka. Egg. Next. Allergies. Okay. Or allergy. Sorry. 3. 4. 5. Let's go quickly. What is bed rest? Sorry. Bed rest. Voila. So you're not open. So you just need some bed rest. So, what? So because you are not familiar with the word bed rest. So in my opinion, you should just quantify the amount of language I need for my direct contact with my patients, at least to be on the safe side. To be on the safe side when I prescribe, when I see the treatment. Before I get to the flow, do the fluency to enhance and stuff. So the first step is to assure safety. To assure safety. Next. Chemist. Next. Cold. Good. Dehydrated. Next. Bravo. I don't know what's wrong with Moroccan doctors with this verb. Oncologists, cardiologists, every time I'm working, I want to examinate. No, because they want just examine. They say 8, ça passe, ça glisse en anglais, so we can say, no, examine. Bravo, examine. Next. Then. Yes? House call. What's the house call? Bravo. Bravo. I'm on a house call. A house call means no. A house call means I am at home, but if they need me, I go to my department. Exactly. Next. Illness. Next. Pronunciation NAM. What is NAM? It's a very important sign for cardiovascular diseases. If you check somebody's limb or hand or arm and he's not feeling anything, so that is NAM. So there is no good flow of blood circulation to the other members of the body. Next. Spasm, yeah. Biopsy, infection. Refer. So your job as a primary care physician is to set the right diagnosis, and then you refer the patient to someone. And you write what? What do you write? You write a referral letter. Referral letter. Dear colleague, this is blah blah blah, primary physician of Mr. blah 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 from Casablanca, Mara, Casa, Meknes, patient X, age, blah blah blah, present to my practice this date with complaints of remember, Sarah? See, complaints of 1, 2, 3, 4, 5. Please advise. Please advise. Advise with S, not with C. Please advise. C is a noun. Where are we? Sneezing. Registered. Sneezing. Surgery. Symptoms. Treatment. Vomit. Short. Vomit. Wound. Yeah. Wound, we need to have some bleeding. If there's no bleeding, it's not a wound. Yeah. Or injury. Wound or injury are the same. Next. Yeah. Yes. Treatment. Referral. Very important. Examination. Follow-up. So at the end of the consultation, you give your patient an appointment. Why? For a? It depends on the condition. Follow-up in 2 weeks, follow-ups in 4 weeks. It depends on. Thank you. Health. Patient consent. Patient consent. Before I do something, you sign for it. Patient consent. That I'm going to do this. What do you think about this language here? Many language. Is it rocket science or piece of cake? Exactly. You know how to pronounce it. The moment you take notes and you start writing down, the moment you contract with yourself that it's 50%, it's gone. There is just 50%. The moment you are not doing any action, everything in your head, your brain will tell you that this is too much. Because the brain doesn't want you to work in a way to protect you. Right? It's tricky. No. Take a pen and paper and start. Start. A goal without a plan, it's just a dream. Thank you so much. So if I have a goal, I don't plan, and I don't act upon the plan, I'm just going to waste my time. So it's very important when you think about English as medical English as a tool to develop my skills and become an international primary physician, take the first step. Take the first step. The first step is an I. Remember, I. I means what? Means immerse. Immerse. What is it? Immerse. If you are here and the language is there, you're not going to immerse. Oh. After immerse, what do we have? Practice. After practice, immerse. B, build vocabulary. I, immerse. 2, build vocabulary. 3, practice. 4, seek, look for feedback and coaching. Look for if I'm practicing which is good or not. It's really, really important. I will send you this. Thanks so much. I was trying to talk to you quickly about the symptoms connected to each part. We'll talk about later. 3 verbs and we finish. 3 verbs and we finish. You want to talk about symptoms and signs? You say 1 verb. Have. Headache. Have headache. Backache. Have. Cold. Have. Fatigue. Have. Anxiety. Have. Verb واحد. Have. Second verb. Measures. Bravo. Take. Blood pressure. Heart beat per minute. Breath per minute. Pulse. Take. Les mesures. Take. Is it clear? All the measures take. Run. Run blood tests, run urine tests, run this exam, MRI exam, X-ray, all of them with the verb run. Let's repeat one more time. The verb here is have. The symptom اللي seen. Take. Measures. Heart rate, blood pressure, whatever you want. And when you talk about tests and exams, you talk about run blood tests. Before we run, we need to have some questions connected to these conditions here. If you want to ask about symptoms, what do you say? Tell me about it. How can I? Next, request for the exam. Can you, or when you hear you, we don't like you. I need you to. He will follow with the empathic language, not you do this the French way. No, I need you to do this blood exam for me. And the last one, measures. I'd like to take your blood pressure. Thank you very, very much. I hope we had more time to talk about different things, but it's good to see you here in person. Thank you so much.